Assalamualaikum everyone. My name is Dr. RAEESA Sawati. Today I am your host and you are watching Health Hour. Today we are going to be discussing a very important and sensitive topic, and that is palliative care and Liverpool care pathway. And understand many of you, if you've been in hospitals or worked with healthcare professionals, you will have come across these terms. Today we have a very special guest with us called Dr. Ashik Ahmed, who is a palliative care consultant at Manchester-on-Infirmary. So palliative care is a very demanding hospital specialty, and apart from that we're also going to be talking about LCP. LCP stands for Liverpool Care Pathway. It was introduced in the late 1990s by the hospice movement, and it was introduced for terminally ill cancer patients. It's now moved on to help people who are coming towards the end of their lives. Assalamu alaikum, Dr. Ashik.
Alaikum assalam.
Thank you very much for joining us on the show today.
Welcome, pleasure to be here.
Okay. आप ये बताएं कि आपका रोल क्या है हॉस्पिटल में? आप palliative care कंसल्टेंट हैं, ये आपका रोल के अंदर आप क्या करते हैं?
जैसे आपने बताया, palliative care is a field that deals with patients जिनका who got very chronic conditions or terminal conditions like cancer या advanced heart conditions या lung failure जो है. और मेरा रोल जो है as a consultant in palliative care, I provide palliative care and symptom control to these patients.
Okay, so आप symptom control provide करते हैं, तो आप कौन से symptoms आप control करते हैं?
बिल्कुल, जैसे मिसाल के तौर पर patients with cancers can have a lot of pain, उनको दर्द बहुत महसूस हो रहा होता है, तो वो दर्द कम करने के लिए मैं I will give different medications to help with their pain. उसी तरह और भी मुख्तलिफ सिम्टम्स जैसे nausea, vomiting, उस टाइप के उनके लिए भी we give specialist treatment for them.
अच्छा, तो मुझको ये समझ आ रही है कि आप पेशेंट को क्योर नहीं करते, इलनेस को एक्टिवली आप ट्रीट नहीं करते, बट आप सिम्टम्स को मैनेज करते हैं, ये सही बात है?
बिल्कुल बिल्कुल, ज़्यादातर जो पेशेंट्स हमारी तरफ रेफ़र हो जाते हैं वो those are patients who've already gone through different treatments, और ट्रीटमेंट के बावजूद unfortunately उनके जो डिज़ीज़ बढ़ रहे होते हैं. So the best we can do for them is to make them more comfortable.
I see.
So we try to provide that comfort by reducing their pain and other symptoms.
Okay, तो ये डिसीजन कौन बनाता है कि आप लेते हैं ये डिसीजन कि अब हमने ट्रीटमेंट स्टॉप करना है और जस्ट सिम्टम्स मैनेज करने हैं, or is it a team that makes that decision?
It's usually a team decision. ज़्यादातर ये होता है कि the patient who's been seen by their own consultants, जैसे heart failure हो गया या lung failure हो गया, they would have been seen by their consultant for काफ़ी महीने या even years, और उन्होंने काफ़ी treatments try किया होता है. So, or during the disease journey, they may have improved occasionally, but they come at a point where, despite all treatments, सब treatment के बावजूद उनके जो condition ख़राब होते जा रहे होते हैं. And that's when those consultants will discuss with me or with my team, and then together we then try to support the patient.
Okay, so ये बहुत मुश्किल चीज़ है देखने के लिए कि someone's रिश्तेदार is becoming ill, is deteriorating, is coming towards the end of their life, and we find in our Asian community we tend to close our eyes to this and not accept कि हमारी our loved one is, you know, मौत के करीब आ रहा है. तो आप कैसे families के साथ बात करते हैं इसके बारे में, कैसे आप support देते हैं?
That's a very good point. जैसे आपने बताया, especially within Asian families, there's मैं समझ सकता हूँ, understandably they want to save their loved ones, their parents or their sisters or brothers, but the reality is there comes a point where despite everything the patient's condition is deteriorating and they're becoming more unwell. तो उस वक्त हम ये करते हैं कि we have a meeting with the patient if that is possible. If not, we are meeting just with the patient's relatives. उनके relatives के साथ हम meeting रखते हैं, फिर हम ये अंदाज़ा लगाते हैं कि इस हद तक उनको पता है बीमारी के बारे में, and then we explain what we're doing and why we're doing what we're doing.
Okay, तो अगर relatives को समझ नहीं आती या अगर patient एक चीज़ कह रहा है कि मैंने ये treatment नहीं लेना और relative रिलेटिव्स कह रहे हैं नहीं आपने ज़रूर ये ट्रीटमेंट लेना, फिर आप क्या करते हैं, कैसे आप दोनों को मिलाते हैं?
Well, that can be sometimes challenging. लेकिन एज अ डॉक्टर हमारा पहला फ़र्ज़ पेशेंट की तरफ है. Our first duty is towards the patient, and as a doctor our first duty is to cause no harm. कोई नुकसान ना पहुंचाए पेशेंट को, क्योंकि हमें पता है कि कुछ ट्रीटमेंट्स हम अगर देंगे तो ज़्यादा नुकसानदेह हो सकता है. तो हम ये हो सकता है कि रिलेटिव्स को इसके बारे में पता ना हो, तो हम बैठ के पेशेंट को और रिलेटिव्स के साथ बैठ के बात करते हैं, उनको एक्सप्लेन करते हैं हम क्यों नहीं कर रहे हैं.
अच्छा.
Most of the time they tend to realize.
Okay. So you mentioned heart failure is one of the conditions that is progressive, it's long term, sometimes it comes to a point where it's difficult to treat. आप कोई और examples दे सकते हैं of illnesses that you commonly work with?
Bilkul, yeah.
Need palliative care.
Exactly. I think first of all, obviously cancers, advanced cancers, and as I said, heart failure. But we also deal with other conditions like advanced lung failure. So what you might have heard of emphysema, which is like advanced lung condition which has got no cure. Pulmonary fibrosis, another condition where the lungs are very distant, they are restricted, and there's no treatment for that. We also deal with patients who've got advanced kidney failure, jinke kidneyan bahut kharab ho, and there's no treatment for them. So any condition which has got no cure, but those patients are suffering from pain or other symptoms, we see those patients.
I see. Okay. So we were also going to move on to the Liverpool care pathway. Can you please tell us a little bit about this?
Yeah, the Liverpool care pathway was started in Liverpool in the late 90s, early 2000s.
Yes.
Uska maqsad ye tha, it was a pathway towards helping patients who are on the last days of life. So jo patient who are approaching end of life, it was to help them, and it was to help the doctors to provide good care.
Achha, okay.
ताकि वो उनको अच्छा केयर मिले, उनके जो आखिरी जो 2-3 दिन रह गए उस वक्त उनको so to make sure that the care is prioritized towards improving their symptoms and providing comfort. That is the original objective of Liverpool care pathway.
Okay, I see. Lekin Dr. Ahmed, what is the main differences between agar you put a patient on the pathway and not on the pathway? What are the main differences?
I think basically Liverpool care pathway shuru hone se pehle there have always been difficulties by hospital doctors to help patients have a good death.
I see.
So the doctors knew that the patient was dying, but they did not know how to keep them comfortable. And what the Liverpool care pathway did was to give them a guideline as to how to keep them comfortable and how to relieve them of their pain. So that was the original objective of the Liverpool care pathway.
I see. Okay, बहुत शुक्रिया, आपने बहुत अच्छा सवाल किया. Thank you very much. Right now we have a caller on the line. Assalamu alaikum. Assalamu alaikum, is there a caller? Sorry, the call's just cut off. Okay, that's fine. Feel free to call again if you have any questions. Just please phone the hotline. So we were talking about symptoms of patients who have maut ke kareeb pahunche hain. Can we also expand on more of the symptoms that they'll experience? You mentioned nausea, vomiting, tiredness. कोई और symptoms हैं जो हम recognize कर सकते हैं कि ये बंदा मौत के करीब आ गया?
Yes, I mean especially when we're talking about जो patients आखिरी 2-3 जिनके साथ सिर्फ those only got a few days to live. Apart from pain, they can also become very confused and agitated. काफ़ी घबराहट और confusion पैदा हो सकता है.
तो डॉक्टर आमिर, आप confusion के लिए क्या करते हैं, क्या treatment आप देते हैं इसके लिए?
सबसे पहले हम ये देखते हैं कि confusion reversible है कि नहीं, ताकि confusion का कोई ऐसी वजूहात है जैसे अगर उनको वो जो डिहाइड्रेटेड है, यानी काफ़ी वो पानी नहीं पी रहा, इसीलिए वो ज़्यादा ब्रेन में वो हो रहा है, तो वो हम ड्रिप स्टार्ट कर सकते हैं. लेकिन साथ साथ हम कुछ मेडिसिन भी दे सकते हैं ताकि उनको थोड़ा सुकून और आराम आ जाए और वो कंफ्यूज ना हो.
Okay, Dr. Ahmed, sorry to interrupt you. We have a caller. Okay, and it's been disconnected again. I do apologise. Okay, we'll just continue. And one of the conditions you mentioned was heart failure. You also talked about kidney disease. One condition that's quite common in our elderly is dementia.
Yes.
आप थोड़ा सा हमको बता सकते हैं इस illness के बारे में क्या होता है?
बिल्कुल. Dementia is getting more and more common because as humans we're living longer.
Yes, that's right.
पहले most people would die when they were 70 or 80. Nowadays आजकल ये common बात है कि people can live up to 80, 90 or beyond. लेकिन उसका ये भी नतीजा है कि our body starts to become less well because of the age, and that can वो brain को भी affect कर सकता है. और brain को इस तरह से affect कर सकता है कि it can have effects on the memory side of things. So dementia basically means loss of उनकी याददाश्त कम हो सकता है और वो काफ़ी confused हो जाते हैं dementia के मरीज़.
Okay, we have a caller now. Do we have a caller on the line? Assalamu alaikum.
Hello.
Assalamu alaikum. Hello.
Walaikum.
Assalamu alaikum. Hello, this is Shahid speaking.
Walaikum salam.
Walaikum assalam. आप क्वेश्चन करें?
मैंने सिर्फ सवाल करना है कि डॉक्टर रईसा स्वाति के लिए सवाल है कि जब एंड ऑफ लाइफ आती है तो हम कैसे अपने पेशेंट के लिए एक्स्ट्रा केयर कर सकते हैं, क्या फैसिलिटी दे सकते हैं, जो सहूलत कर सकते हैं कि उनका टाइम अच्छा हो घर में, तो कैसे हम उनकी मदद कर सकते हैं कि आप कोई ओपनली एक्सप्लेन कर सकें आपकी मेडिकल नॉलेज से. डॉक्टर रईसा स्वाति के लिए सवाल है प्लीज.
Okay, thank you very much आपकी कॉल के लिए. Can you please just repeat the question again? Did you?
That's right. I might have missed that. Could you repeat that question, please?
And I think we have another caller. Do we have another caller on the line? Assalamu alaikum. Assalamu alaikum. Hello?
Hello?
Assalamu alaikum. Thank you for
Assalamu alaikum.
calling.
Hello?
Hello?
Assalamu alaikum.
Walaikum salam.
Caller, can you please turn the TV off because we can hear the background noise?
Sorry, did you hear me, sister?
Yes, if you can turn the TV off in the background because we have some background noise. Thank you very much for calling. What is your question?
I can hear you, so shall I call back to you again?
No, it's fine. What's your question?
Yeah, I have a question, but your sound here is not clear, it's breaking.
Okay, ask your question, please.
Yeah, my question is, I wanted to ask Sister Doctor that question. I'm a heart patient, and I had altogether one open heart surgery, and the rest of those two valvoplasty surgery, one angiogram, and the rest of those ablation. And recently, I think 5 months ago, they did the elective ablation.
Right.
But still, Dr. Sahab, मेरा जो heart condition है, Alhamdulillah, my consultants, doctors, you know, they are very good. But time to time, doctor, मेरा जो heart का ना palpitation बहुत fast हो जाती है. Even जो हम heart medication लेते हैं, उसका हमें अभी आज पता चला. Emergency call हमने की थी क्योंकि कल हमें around 12 o'clock मेरा बहुत ज़्यादा हमें हाथ पैर मेरे काँप रहे थे, which is not unusual for me.
Right.
लेकिन डॉक्टर it was too much, बहुत ज़्यादा हम घबरा गए थे. तो अभी प्रोग्राम हमने टीवी खोला तो हम बहुत I was very pleased डॉक्टर कि डॉक्टर हम बहुत जल्दी पैनिक हो जाते हैं और हम घबरा जाते हैं कि या अल्लाह आप क्या होगा. जब मेरी पल्पिटेशन फास्ट होती है तो उस वक्त हम बिल्कुल एकदम बस I try to recite my Mawla name.
Okay,
try
sister,
to
तो आपका
recite
question
du'as,
क्या है?
which my mom
What's your
always
question?
said कि try to. तो अल्हम्दुलिल्लाह हम ठीक हो जाते हैं बाद में. लेकिन डॉक्टर वो जो मोमेंट होते हैं जब मेरी हार्ट बीट फास्ट होती है विद फॉर सेकेंड्स डॉक्टर, तो वो मेरे लिए समझ लीजिए बहुत ही घंटों की तरह के मेरे कई आवर्स के तरह होती है कि उस वक्त हमें कभी कभी पसीना आ जाता है. हम इतना ज़्यादा कभी कभी पैनिक हो जाते हैं ठुक ठुक, तो क्योंकि हमें मेटालिक वॉल्व डॉक्टर हमारे उन्होंने माइट्रल वॉल्व रिप्लेस करके मेटालिक वॉल्व एडजस्ट किया है, और
अच्छा,
एट द सेम टाइम दे डिड one valve replacement,
Okay, sister,
one valve repair and one
we'll
home
explain
repair.
later on, inshallah. Okay, if you can call back if you have an exact question. Otherwise, thank you very much, and you can consult your GP if possible. And we have one more caller. Okay, and that's been dropped as well.
I suppose the previous caller was wanting to know about some of the symptoms.
Yes, that's right.
And I mean, obviously, I'm not a cardiologist, but it looks like she gets very panicky, and that makes her heart beat faster. Obviously, there will be other heart medications that can help with the beating of the heart. But if it's panic and anxiety, बहुत ज़्यादा घबराहट की वजह से है, तो there are medications we can give for her to feel more relaxed. मेरे ख्याल से she can go to a GP to get those prescribed.
Okay.
Yeah.
I think the caller previous to that, he was asking how do you notice that a person's coming towards the end of their lives? What symptoms do they experience?
Right. Well, it's a combination of things. तो सबसे पहले हम ये देखते हैं कि what is the patient's background disease.
Yes.
तो वो देखते हैं first of all. फिर हम ये देखते हैं कि किस हद तक उनका इलाज हो चुका है. So what all treatments they have had already.
Yes.
And thirdly, we look at what has been the result of those treatments. So whether that's improved or whether their condition has progressed treatment के बावजूद. फिर हम देखते हैं कि patient के जो what we call in science is performance status, यानी किस हद तक patient काबिल है, उनकी काबिलियत में काफ़ी वो हो गया हो. So these are things that we look at, and we also look at some blood tests.
I see.
So and also we ask the patient's family.
Okay.
So it's a combination of things
Yeah.
that we use to find out how long the patient has got.
I see. Okay, we have a caller on the line.
handle please.
Hello, Assalamu alaikum.
अस्सलाम मेरा नाम शाहिद है, मैंने पहले भी फोन किया था. मैं सिर्फ आप डॉक्टर रईसा स्वाति को क्वेश्चन करना चाहता हूँ कि घर में कोई एंड ऑफ लाइफ पेशेंट हो तो घर वालों को पता चले कि इनके पास टाइम थोड़ा रह गया है, आप डॉक्टर रईसा स्वाति कैसे एक्सप्लेन कर सकते हैं कि हम कैसे उनकी हेल्प कर सकते हैं, घर वाले फैमिली मेम्बर्स कि उनके लिए आसानी हो जाए, तो कैसे हम हेल्प ले सकते हैं जीपी से या हॉस्पिटल से, जिनको जो सी भी फैसिलिटी चाहिए हम कैसे कैसे उनकी हेल्प दे सकते हैं. डॉक्टर रईसा स्वाति ने बहुत शुक्रिया होगा.
Okay, thank you very much for your call.
Thank you. Yeah, अगर आपके फैमिली में या आप जानते हैं किसी को जो who's approaching end of life, तो first of all आप अपने GP के साथ बात कर सकते हैं, और community में we have our own palliative care team in the community. Community में they are called Macmillan nurses, और ये Macmillan nurses बाकायदा palliative care की training ले चुके होते हैं, so they are specially trained in palliative care. और वो आपको और आपके फैमिली को और पेशेंट को सपोर्ट कर सकते हैं, और वो आपके अगर पेशेंट इफ़ द पेशेंट वांट्स टू बी एट देयर ओन होम्स, अपने ही घर में रहना चाहते हैं एंड स्पेंड देयर लास्ट डेज इन देयर ओन होम्स, वो भी दे कैन हेल्प देम डू दैट बाय प्रोवाइडिंग पैलिएटिव केयर इन योर ओन होम. ये we can try our best to do that, लेकिन कभी कभार ये हो सकता है कि they may need to be admitted to hospital, but most of the times they would be able to help people, to support you and to support your family and the patient through the Macmillan nurses and the GP. Because ये जो मैंने आपको बताया है पहले कि ये symptoms जो है, दर्द हो या confusion हो, they can all be in most cases managed in your own homes with the help of the nurses.
So we understand there's a lot of facilities available in the community for people who have come towards the end of their life. We've mentioned Macmillan nurses, supportive care at home, hospice movement. Mashallah, both facilities for everyone to have access to. And we have another caller on the line. Hello, Assalamu alaikum.
Hello, alaikum salam. अभी हम आए थे कुछ देर पहले. I'm sorry. हम काफ़ी हमने लंबी गुफ्तगू कर दी थी, लेकिन आई जस्ट वांटेड टू आस्क कि ये हम बहुत जल्दी पैनिक हो जाते हैं डॉक्टर साहब जी, तो हम चाहते थे कि आप कुछ बताएं कि
जी
हम
जी
क्या करें डॉक्टर ऐसे मोमेंट में, स्पेशली जब हम जैसे ट्रैवल कर रहे हैं
जी
तो उस वक्त हमें अपने आप को संभालना डॉक्टर,
जी
वो हम सुनना चाहते थे कि आप क्या अर्ज करते हैं डॉक्टर साहब। थैंक यू वेरी मच।
जी no worries and thank you for the question. I think if you probably the same caller who rang earlier about heart problems, obviously अगर आपको घबराहट हो रहा हो तो and if your heart is beating fast और अगर ये अक्सर हो रहा है then you will have to go back to your cardiologist and find out whether you need to make your अगर आपके tablets में थोड़ा changes शायद करना पड़ेगा. But the other thing is from what I hear, जितना तक मैंने सुना है आप जल्दी घबरा जाते भी हैं, तो उसके लिए first of all you can have relaxation techniques. There are specific breathing exercises जो आप आपके GP के ज़रिए they can refer you to a person who will help you do breathing exercises. और बाकायदा कुछ टैबलेट्स भी है जो आप अपने घर में रख सकते हैं जिसके ज़रिए आप ज़्यादा काम और रिलैक्स्ड फील कर सकते हैं. और जैसे आपने बताया कि आप ज़्यादा घबराते जब आपने कोई सफ़र करना हो, if you want to travel, what you can do is you can take this tablet about half an hour before you travel and that will keep you more relaxed. Now I don't want to go into the technical details about tablets, but if you go to your GP then they will be able to give you these medications and that would help you.
Thank you very much. That was a brilliant
Okay.
answer to that question. We were talking about like care at home, patients who want care at home, like how can we make life better for them at home. But मैंने ये भी पूछना था कि एक treatments hospital में मिलती हैं, we take care of patients at home, लेकिन कोई और middle way है जहाँ patients को treatment मिल सकता है that's not the hospital but not home either?
Of course, there's something called the hospice. The hospice movement has been around in the UK for about 35 years. Hospice एक ऐसी जगह है where you've got specialist palliative care teams who can provide palliative care away from the hospital but in a more quieter environment. वहाँ पे ज़्यादा इतना आप खुद जानते हैं और patients भी जानते होंगे कि hospital is always a busy place, whereas a hospice is a lot more quieter.
जी, लेकिन डॉक्टर अहमद मैंने ये सुना है हमारी एशियन कम्युनिटी ये मेंटालिटी है कि अगर आप पेशेंट को हॉस्पिस भेज रहे हैं कि आप उनको you're sending them there to die. Yes, what do you think of this thinking?
I think ये आपने बहुत सही फरमाया. I mean क्योंकि मैं हॉस्पिटल में और हॉस्पिस में भी काम करता हूँ और मेरे तजुर्बा है कि there are not many people from the Asian community who would be ready to go to hospice. It is due to some of the शायद ये गलत फहमी है कि ये हॉस्पिस में लोग तभी जाते हैं जब when they are in the last days of life.
Most हमारे लोग कहते हैं कि गरीब रहे और हमारे close relatives उनका ख्याल रखें. You know, we don't feel कि हम उनको कहीं और जगह बस रहने दें.
हाँ, नहीं, of course, I mean, I can understand कि there's no place like home. घर जैसा कोई जगह नहीं है. But at the same time, हमें ये भी मुझे ये भी पता है कि from experience there may be certain instances where you can't look after the patient at home because they got a lot of complex conditions. तो hospice का ये फ़ायदा है कि first of all, of course, if you've got someone who've got a lot of pain which cannot be controlled at home, they can come to hospice, get their pain treated and go back home.
लेकिन ये दवाएं घर में क्यों नहीं मिल सकती?
कभी कभार ये है कि they may not be in tablets. You might need to give them as a drip. And that needs to be monitored. Monitor करना होता है 24 घंटे या 48 घंटे. तो उसके लिए एक specialist center चाहिए होता है. तो उसके लिए hospital की ज़रूरत नहीं है, लेकिन there need to be a place where it can be done by specialists, and that is where the hospice comes into play.
Okay. तो मैंने ये भी पूछना था कि you know it's a very difficult situation to see your रिश्तेदार मौत के करीब आ रहा है, उसको उलझन हो रही है, वो पेन महसूस कर रहा है, तो it's very very difficult time. तो आप क्या एडवाइस दे सकते हैं हमको कि कैसे हम ये सिचुएशन में मैनेज कर सकते हैं? कोई हेल्प अवेलेबल है apart from doctors and nurses? कुछ और like a mental support के लिए like psychological or emotional support?
बिल्कुल. I mean, yes, I mean it is always you know, it's always kind of uncomfortable for any one of us to see our loved ones you know, dying or unwell. So as part of our palliative care team, we don't just have medical team. हमारे साथ एक psychologist भी है जो emotional support दे सकते हैं families को. साथ साथ to help the patient, we have got a physiotherapist and someone called occupational therapist, ताकि वो patient को ये मदद करे कि whether they can be a bit more active if possible. और we have also got the spiritual team, यानी जैसे हमारे मुस्लिम patients हो गए, उनको अगर कोई मौलाना की ज़रूरत हो, then we can get the hospital chaplain, Muslim chaplain जो है, they can come and talk to them about the spiritual Islamic side of things. In the same way, if it is from some other community, whether Hindu community or Christian, they can have their own, people to come and help them. So it's a combination of things.
Okay, so बहुत बड़ी टीम होती है हॉस्पिटल में
बिल्कुल
के साथ हम हेल्प कर सकते हैं.
बिल्कुल.
Okay, thank you very much, Dr. Ahmed. We're just going to go for a short break now, if that's okay. We'll see you back after the break. Thank you very much.